Great. Thank you, Dr. Walker, and welcome to everyone to our COVID-19 Disaster Research and Prevention Symposium. I am Elaine Szymanski from Baylor College of Medicine, and I will be the facilitator for session one of the symposium. And it is my great pleasure to introduce Dr. Francesca Dominici, who is our first speaker. Dr. Dominici is the director of the Harvard Data Science Initiative at Harvard University and the Clarence James Gamble Professor of Biostatistics, Population and Data Science at the Harvard T.H. Chan School of Public Health. She is an elected member of the National Academy of Medicine and of the International Society of Mathematical Statistics. Dr. Dominici leads an interdisciplinary group of scientists with the ultimate goal of addressing important questions in environmental health science, climate change, and health policy. Dr. Dominici will talk to us today about some studies that she has conducted during the COVID-19 pandemic. Dr. Dominici?
Thank you. Thank you very much for inviting me. Sorry, just want to, can you hear me? Good. Okay. Well, so thank you very much for inviting me. I am delighted to share with you my research on the intersection of environmental justice, exposure to air pollution, and COVID-19. So just in terms of telling a little bit about the type of research question, they have been very much the forefront of my focus in the last year. First, to address whether or not ambient level of air pollution, even if they're below the National Ambient Air Quality Standard, are safe to human health. Second question is, fortunately, the air is cleaner today, but are we addressing environmental injustice properly? And importantly, does long-term exposure to air pollution increases the COVID-19 mortality rate? So first of all, being a data scientist and leading data science at Harvard, I like to say that data science is instrumental for policy change. And I think has been instrumental in the context of cleaning up the air that we breathe. Data has been filling into data science, who has been providing the backbone to provide evidence of whether or not air pollution is affecting health, has been leading to policy change, and policy change is leading to air that is cleaner. This is a plot that shows the level of the ambient exposure to many air pollutants, and you can see that thanks to the Clean Air Act and thanks to policy that is based on evidence, we have been the level of air pollution in the air have been declining over time, and our skyline are cleaner. However, even though the air pollution is lower than it used to be, the question is it lower enough? And so if we are breathing levels of pollution that are below the National Ambient Air Quality Standard, do we still see an increase in mortality risk? And are some populations more at risk than others? My role has been really to, I always thought that data science and policy it cannot be effective unless you are relying on enormous amount of data. So we have been basically analyzing claims data, so electronic medical record data for the entire population in the United States enrolled in Medicare. So we are over 67 million of people that are covering over 95% of the population in the United States older than 65. We are looking for all-cause mortality and cause-specific hospitalization. We have individual level information on day of death, when they enter into the Medicare, sex, race, and whether are also eligible for Medicaid as a surrogate for lower socioeconomic status. Importantly, we have a zip code of residence, so we know where this cohort live. So there has been a tremendous amount of effort in really harmonizing, integrating heterogeneous source of data. And we are all have been appreciating during the pandemic the importance of being able to access to reliable data. So both in terms of information about the environment, information about socioeconomic status, information about health. And building these, I call it almost over time, research data platforms. So they're really a research laboratory that takes information on a national scale on exposure, the urban environment, risk factors, and try to understand what are the relationship with health to very effectively prevent and treat disease. It was actually really interesting that throughout these crises of the pandemic, we have been seeing almost on the front page of the New York Times the importance of integrating and visualizing properly national data sources. So that's really what we have been focusing on, building extremely rich national data sources where we link exposure to pollution, health outcome, socioeconomic status for what I call it the dynamic cohort. So over 60 million people living in the United States with over 500 million observation. In terms of the exposure to air pollution, you might all know that the EPA is doing a wonderful job in terms of measuring levels of ambient air pollution in the United States. So this is a map that shows where the monitors are located. However, you can see that there are still areas in the United States that are not monitored really well. And especially, this is especially important if you want to assess as whether or not low level of air pollution are harmful to human health. And so thanks to now the tremendous advances in accessing data and machine learning and artificial intelligence through my colleague, Joel Schwartz, he has been leading a group at Harvard that basically what we do, we take information from satellite that are an imprecise measure of air pollution, weather data, land use data. We build massive artificial intelligence models. So they're trained on monitoring data. And basically what we'll be able to do is to come up with very accurate estimates of the level of air pollution, ambient level of fine particulate matter on a daily basis, a 1 kilometer to 1 kilometer grid for all the continental United States. And that's extremely important because information on the health experience of the Medicare population is indeed available for the entire continental United States. So by doing this, we are able to assess the daily level of fine particulate matter that people in the US are breathing over time for the last 17 years and linking it to our electronic medical record for the entire Medicare population. In 2017, we published this landmark study, which was the first study that really analyzed the relationship between exposure to air pollution and mortality for the entire Medicare population. It's important here to keep in mind, if you just focus on the last column on this table, that we had over 32 million elderly in the United States that breathe the level of air pollution below 12 microgram per cubic meter. So below what they call it the safety level. And that is really important because we want to see whether or not this 12 microgram per cubic meter is lower enough. And if it's not, then this is going to inform the new regulation for fine particulate matter in the United States. So we have a 32 million breathing, let's say, low level of air pollution. We have 11 million deaths among this population, and we have over 247 million observation. And similar analysis we have conducted for ozone. We have the median number of years of is 7 years. Very rich information to understand the effect of air pollution. So the key finding was basically that if you take on average for the whole nation, and so you look for a moment at this horizontal line, we see that a 10 microgram per cubic increase in fine particulate matter lead to a 7.3% increase in all-cause mortality overall for the entire United States. Very concerning is that we see racial differences where the Black population experience a mortality rate for exposure to ambient PM 2.5 that is 3 times higher than the national average. We also have Asian and Hispanic experiencing higher mortality risk of air pollution, and also people that are eligible for Medicaid and therefore with a lower socioeconomic status also experiencing higher risk. So this attracted a tremendous amount of press attention 3 years ago, especially as we were in the middle of whether or not revising the National Ambient Air Quality Standard, and especially raising a lot of questions with respect to environmental justice and air pollution. And I've been really pleased to interact with Senator Cory Booker to really try to better understand these issues of environmental justice. I'm just going to tell you a little bit briefly about this work, because this is all ties together in terms of the relationship between environmental justice, air pollution, and COVID-19. So as we all know, unfortunately, Black Americans are suffering disproportionately from air pollution and coronavirus death. And I just want to walk you through some data visualization to see what's happening in the context of air pollution and racial disparities in the United States. So first of all, I'm going to tell something that I think all of you are very familiar, which is a good news, which is that air pollution has decreased drastically in the United States from 2000 to 2006. 16. So we have that the population weighted average of PM 2.5 has decreased by 43%. And so you can see that the map on top is the exposure of air pollution in 2000, the one on the bottom in 2016. And you can see that the US is less orange. So that means the levels of air pollution are being going down. I want to spend a few minutes slowly to walk you through what I'm going to show you here, because I think that if you follow me, there is something striking that you are going to notice, and you can see actually Houston is in the middle of it. Let me start by pointing your attention on the map on the left. So the map on the left is showing data for the year 2010, and is showing the area in the United States that have a pollution level in 2010 higher than 8 microgram per cubic meter. So I would say the area that are more polluted in 2010. And so you can see that in 2010, mostly half of the eastern part of the United States is breathe level, say, high level of pollution, and California. And then the area in blue are the area where we see higher percentage of Black Americans, where basically the percentage of Black Americans in that area are higher than the national average. So in 2010, if you're still focusing on this map on your left, what we see is approximately 50% of the country lives in areas that are with PM 2.5 higher than 8. And then we have that among the geographical area that breathe high pollution level, half are in areas that more in the southern part, which have higher percentage of Black population, and higher in half of the country is where there is higher percentage of white population. Now, let's focusing on 2016. So what you see in 2016 is still we're only showing the geographical area with our PM higher than 8. And so you can see that the number of geographical area with higher level of pollution is lower, because I told you that pollution has been going down. However, and this is what I found myself concerned, is that you can see that among the area that are still polluted in 2016, the only area where there is higher percentage of the Black population. So what's happening here, and the message I want to send you here, is that even though PM 2.5 has been declining for on average for the continental United States has not been declining equally for everyone. We have been cleaning the pollution mostly in the area where the white population lives, but we haven't cleaning up the air in the same way where there is a larger percentage of black population. Now, if you do all of the statistics, what this blood plot shows is that basically, although the percentage, so the blue line and the green line shows the percentage of area in the United States, they experience PM 2.5 higher than 8. So basically, they're going down because, as I said, the pollution is going down. However, the bar is show you the amount of inequity or inequality in exposure to air pollution over time. And well, basically, the message is, although the air pollution levels are declining, the amount of inequities and environmental disparities among racial and socioeconomic groups in the United States are actually increasing. So that's lead really to the work about, connecting together air pollution, environmental justice, and COVID-19. We were the first to provide a national study looking at the relationship between exposure to fine particulate matter and COVID-19 mortality. The study was covered by the New York Times back last April. It was co-led by a current PhD student in my lab, Zhao Hu, and faculty member Rachel Nethery. And basically, we looked at the relationship between exposure to fine particulate matter, historical exposure to fine particulate matter, and coronavirus death rates. The reason why I immediately started to look at this question was because in the past, before the COVID-19 pandemic, I've done research, as you can see, extensively research on health impact of air pollution, but also when I started to learn that COVID-19 can cause a viral pneumonia and acute respiratory distress syndrome. Previously, we had actually published work that linked exposure to fine particulate matter to acute respiratory distress syndrome. So that immediately starts for me to think about whether air pollution, because air pollution is a cause of acute respiratory distress syndrome, and because acute respiratory distress syndrome is a cause for COVID-19 mortality, that's really prompted me to address this question. Since we published that study, there has been so much more research also to further understand the biological mechanism between exposure to air pollution and COVID-19. This is just a citation basically to just making the point that chronic exposure to fine particulate matter can penetrate very deep into the lungs, severely compromise your immune system, and therefore, if you are being infected by the virus, you might have less ability to fight it. So, as I said, we had working very extensively on the health impact of fine particulate matter and how fine particulate matter can affect the heart and lung disease, can affect the brain, and also can impact our lung function. So basically, why we decided to investigate the effect of fine particulate matter on COVID-19 deaths. So I think that, it was very clear there was a tremendous amount of overlap between the diseases that were affected by fine particulate matter and the diseases that are major clinical condition or comorbidity that could make the COVID-19 pandemic worse. So we hypothesized that because of long-term exposure to fine particulate matter, and we know affect the respiratory and cardiovascular system, and it can create also it can affect our immune system. It could also exacerbate the severity of COVID-19 infection and might increase the risk of death. So we published this study back in November 2020, and also it's very important for me to stress that the entire data and the code and everything is fully publicly available and reproducible. And I think what was really important for me, and something I'm really proud, that this initiated research on this question by many colleagues all around the world that have been trying to address the same question and have addressed this this question. Actually, in a certain way, I would say very proudly, much better than even we did in this particular study. So as I show you, we have already estimated exposure to fine particulate matter for all of the continental United States for the last 20 years. We gathered data from the Johns Hopkins Center on county level, number of deaths for COVID-19. We have already built, previously the data infrastructure for all of the potential confounding factors. And so we basically build a statistical model to try, to the best of our ability and to best of the data that were available, to assess the relationship between exposure to pollution and county mortality rates. Well, what we found was at that time really striking, but I think at this point, considering the pace of research, I think this relationship has now, I would say, validated or reproduced, I think, quite consistently from many, many studies around the world, and I have to say also many studies in Europe. So basically what we found is that if you take two counties in the United States where one has historical exposure to fine pollution that is 1 unit higher than another, that is associated with an 11% increase in COVID-19 mortality rate. So basically, one way to think about it in a very simple way, if you have two counties, they are very similar to each other, and to the degree that we can have a similar population density, socioeconomic status, smoking rates, whatever you think about it, that make them as similar as possible. The one that has been exposed to a higher historical level of exposure to air pollution had 11% risk of death. The plot here shows that the estimated mortality ratio associated with the exposure to air pollution as more data accumulated unfortunately, on the number of deaths from April up to June of last year. The other important thing that this is not new findings, unfortunately, and also another very well replicated results is that we had a 49% increase in mortality rate for COVID-19 in geographical area that have a 14% increase in Black residents. So counties that have a higher percentage of Black residents experience much higher percentage of COVID-19 mortality rate. The other thing is that this was a really important international collaboration with many of European colleagues, and actually try to estimate the attributable number of COVID-19 deaths that were attributable to fossil fuel related and all anthropogenic sources of air. And so we see that, for example, we estimated that in Europe, of a population of 628 million, we have that 13% of the COVID-19 mortality were attributable to fossil fuel air pollution. We see that in East Asia, that percentage gets to 15%, in North America to 14%. So I wanted to conclude just to say, and giving a plug of the importance of reproducible workflow. And so in terms of when we do this type of study, I think it's extremely important, as we have done in our study in the Science Advance paper, to the degree as possible to share the data and the entire thinking about how the study has been conceived, how the data has been gathered, how the data has been harmonized and analyzed. And I think in this context of addressing this question, this has really led to tremendous amount of interdisciplinary and international collaboration. And finally, I just wanted to acknowledge that we have at Harvard a group of scientists from many different places, as you can see, from many different institutions, to really work together in addressing the intersection of exposure to air pollution, health, COVID-19, and environmental justice. I wanted to conclude here, so then there is time for questions. Thank you very much for your attention.
Thank you, Dr. Dominici, for that fantastic overview of your work and including some of your recent work looking at the impact of air pollution on COVID-19 mortality. Let me also encourage the audience to use the Q&A box to pose any questions that you might have for the speakers. One question, Dr. Dominici, is your air pollution and COVID-19 mortality study relied on county level data. And a question has been raised about whether or not there's more recent work to refine these county level models to explore more spatially resolved estimates, or perhaps to examine disparity-specific hypotheses, in terms of whether communities of color or of low socioeconomic position might carry, again, higher burden of air pollution, COVID-19 related comorbidity or COVID-19 mortality.
Yeah, no, I'm really glad you asked this question, because that study had this enormous limitation that is a county level analysis, and we all know in any epidemiological investigation that a county level analysis is really crude. So in fact, in the paper, we positioned the paper really in terms of the strengths and limitation of ecological regression. And that is really why I started the presentation by saying that access to data is paramount for this type of work. And unfortunately, to my knowledge, as up today, we still do not have a centralized database on COVID-19 cases and deaths that it's not aggregated at the county level. And, until that's not available, and that was my point when we work on that study, it was like, I hear you, but this is all the old data that we have. And, I think in other countries, especially in Europe, they have been able, especially in England and in the Netherlands, they had access to individual level record. And it was reassuring to me that they were finding similar relationship there. As of today, I know, for example, that the CDC has put some individual level information on COVID-19 patient, and I was excited to see that. And we still immediately started to work on it. However, the zip code of, the place of residence of the CDC database is once again at the county level. And then when we start looking at that data is not representative of the whole population. So I think that this is really a call here for the scientific community to put as pressure as we can, because I did understand why, as of today, we still cannot come with a nationwide database where information on COVID-19 is centralized, where we have the age and the race of the patient, because that did exist.
Thank you. Another question, you spoke in the beginning of your talk about the importance of translation and of translating research findings to policy. So one question would be, and I guess this question has two parts, is what's one policy implication of your work as it relates to efforts to mitigate air pollution? And then a second question that's policy oriented that has come up is first a comment that clearly comorbidities in low SES communities may be contributing to poor health outcomes, like, for example, obesity. So the question that's been asked is, at what point are policy initiatives targeting other SES factors, for example, food deserts, perhaps more important or more effective than one that is focused on air pollution control?
Yeah, that's an excellent question. So I think in terms of the first question of policy for air pollution, I do think that it is undeniable at this point that the level of 12 microgram per cubic meter, the national ambient air quality standard, should be lowered. I think under the Trump administration, it was decided not to lower it, which was also why the study got really a lot of attention, because at the time where EPA under Trump was deciding not to lower the national ambient air quality standard, we came up with this study. Now, my understanding is the EPA under Biden might revisit that decision. So I think in general, I think 12 is not lower enough. And I think there is not only the evidence of my own studies, but evidence from all around the world. Mm-hmm. Now, having said that, I also think that when we were looking at our research of environmental disparity, and so, in a certain way, try to address your question, your second question, Elaine, I also think that it's not enough to impose a policy and then without really giving even more attention to the vulnerable communities. So to me, I think we should lower the national ambient air quality standard from 12 potentially to 10. But then the job shouldn't finish there, because now we know we have all of the data that we have all of the tools to know which are the most vulnerable community in terms of having higher comorbidity, and in terms of being more vulnerable to exposure to air pollution. And now that also have been devastated by the COVID-19 pandemic. So I do think that now that we can identify this community with a tremendous amount of degree of accuracy, because the data are all available, we should also have additional effort to target this community and implement additional policy to combat and prevent disease in this community. So might be further lowering pollution even there, not allowing additional polluting permit in this community, making sure that prevention for cardiovascular disease, diabetes, and obesity are putting in place there. Because what we have learned with the pandemic, above and beyond the pollution, is that if we make extra effort for prevention of disease, then when something, drastic happen, whether it's a Harvey or whether it's a pandemic, we are better prepared. So I call it personalized prevention. I do think that we are now at the point to do a very good job in personalized prevention, and that should be prioritized, because even if it's expensive, it's definitely going to be less expensive than when we need to combat the next crisis.
Great, thank you. A question, as you know, with particulate matter, PM varies by size, it varies by chemical composition. And so a question has come up is whether or not there are available data as part of the EPA network that is granular enough to actually look at risks associated with specific chemical constituents of particulate matter?
Yeah, that's another excellent question. So the quick answer is yes and no. Yes, data is available, and the EPA has been instituted some monitoring network around the United States that measure the chemical composition. Now, a few years ago, I would say 5 to 7 years ago, there was a tremendous attention from the scientific community to really analyze that data, the composition data, to really see whether we could disentangle whether one component of PM is more harmful than other. Unfortunately, what happened there then was that we wrote a lot of papers, and there was no evidence of consistency. And I think the problem is that, yes, there was data, but the data was not, I think, good enough to really disentangle this effect. As you can imagine, there are enormous issues. These are multiple components, and they're highly correlated, they're measured with error. Exposure assessment is complicated. Anyway, so I don't want to say we failed, but I don't think that there was no consensus in the community. Now, that was 5 to 7 years ago. What is really interesting now is that I think now we're better positioned. We are better positioned because now data are better and tools are better. So both in terms of atmospheric chemistry models and machine learning model. So I'm personally re-energized and starting to work now with a new sense of energy and optimism in really try it again. And so I see, my sense is that you will see in the next 2 years more research on understanding the toxicity of the different components. Whether or not the research community will be successful enough to disentangle and find one or two so then we can better target the sources, then I think it's too early to say. But I think we are in a better position. We have a better shot than we had 7 years ago.
Great, thank you. And let me ask you one last question, if I may. There was a question that had come up about how the audience might find out about levels of air pollution in their community. Is it high or low relative to other places? Are there maps or a database that's available where individuals can find out about the air pollution levels in the neighborhoods they live in?
So yes, I think my understanding is, so there are different sources that they can look at, and of course, you know, in the United States we are so decentralized that things are different in different states. But I think so. First of all, there is a website. It's called Air Now, and that is maintained by the Environmental Protection Agency that gave real-time measures of air pollution in different parts of the United States. Second, I think that they should look at their local Department of Health. And third, in some communities in the United States, there is this new generation of low-cost sensor. And so they're placing, and I think the question is just Google whether or not they're monitoring air pollution at the very local level through this low-cost sensor. So for example, now it's very popular, a very extensive low-cost monitoring sensoring in California. And so I think there are Google Maps that you can actually see the level. So I think it's just a combination of all three these data sources: Environmental Protection Agency, your local Department of Health, and whether there are low-cost sensor Google here in your community. I think specifically in Texas, and this is something I haven't talked about much, we didn't do a study on ozone and COVID-19, but we did study on ozone and other outcome, and we know that ozone is also extremely harmful. And so I think that in the area, in Texas area, I think ozone is also something to really look at in addition to fine particulate matter.
Great, thank you. Well, again, thank you for that engaging talk, and thank you for your responses to some of the questions that have been posed. Dr. Dominici, many thanks.
Thank you, my pleasure. Thank you for attention.